Good afternoon. I'm Paul Hills. I'm the president and CEO of NCH Healthcare, and delighted to be with you today to share some exciting things that are going on at NCH and specifically here on Marco Island. And we've got our medical team here that's based in Marco Island, and I'm going to turn it over to them, and then I'll be back at the end with a couple of other exciting announcements. But for right now, I'm going to turn it over to Caitlin Magdalener. I hope I got that right, Caitlin. Did I?
Close enough.
Good, close enough. And Caitlin is our lead here in Marco Island. And Caitlin, I'd like for you to take it from here.
Hi, my name is Caitlin Magdalener. I'm the nursing supervisor for Marco Island Urgent Care here on Marco Island. We've been here on the island serving this community and our visitors for 30 plus years. We're open 365 days a year with convenient hours to help our patients. We're open at 8 a.m. until 7:30 p.m. Except for some holidays, we close a little earlier. We're conveniently located in the center of Marco Island. And we have availability for patients to see our doctors either before traditional doctor's offices open and a little bit after they close. We're staffed by board certified emergency room physicians. We always have one doctor on site at all times when we're open to see patients. These doctors, most of them have spent much time in emergency medicine, and they continue to keep up their education in regard to the best practices for our patients. Our nurses are also all registered nurses, and we always have two on site at all times to take care of our patients. Many of our staff are local to Marco Island, so they're in the community taking care of our community. We provide walk-in treatment for non-emergencies and illnesses that you think can't wait for a traditional scheduled doctor's appointment. Some common ailments that we treat at the urgent care are sore throats, mild asthma, cold and flu symptoms. We don't replace the need for a primary care physician, but we're a great option for quick treatment here on the island. In our current building, we have X-ray and CAT scan capabilities for both inpatients and outpatients in order to have a quick diagnosis of injuries. Marco Island is not an emergency room. We definitely do not replace the need to call 911 should you have chest pain or stroke-like symptoms. But if a patient were to come to us and need to be seen in an emergency room, we do offer a quick transition to be able to be brought to one of our hospitals or any local hospital. NCH has been recognized nationally for their care. We're ranked number 11 for quality of care out of more than 260 hospitals in Florida. NCH was also named among the top 250 hospitals in the nation for the 4th year in a row last month by Health Grades. Let's see. We've been here for 30 years to serve this community. We hope to continue to be able to serve our community. And I'd like to pass the mic over to Dr. Babo, who's primary care just next door with us.
Thank you very much. Hi, thanks for having us here. My name is Angelo Babo. I'm a family physician. I'm from Chicago, and I am new to this area as of February the 15th. I'm not new to Marco and Naples. I have been coming down for many years with my in-laws, had a place in Naples, probably 3 to 5 times a year. So now I live here, so that's kind of wonderful. I'm from Chicago. I grew up on the west side, northwest side area of Chicago. I went to high school in Oak Park, Fenwick High School in Oak Park, and Loyola University for my undergraduate degree. And I did my medical school at Midwestern University, Chicago College of Osteopathic Medicine. My residency was also in Chicago, a lot of Chicago, Swedish Covenant Hospital, family medicine. And I have been in practice in and around the North Shore suburbs of Chicago for nearly 30 years. My last situation was the North Shore University Health Systems office, and I was there for about 9 years. And a lot of my patients actually wintered in Southwest Florida, indeed in Marco. So I was sort of the pitcher then, and now I'm the catcher for a lot of my seasonal patients. I'm a family doctor, so family medicine has a couple of kind of nuances. We sort of don't see divisions in age, so I see patients at all stages and ages. I even used to deliver babies, but I don't do that anymore. Probably I do, teens on up is really kind of like my wheelhouse, but I can see a little younger than that too. The other thing about family medicine is it sees patients through a family and community lens, and Marco is kind of a family. It's a little town, even with a lot of people from a lot of different parts of the country and the world. I also have had a real interest in access in my career. Big part of what I've been doing over the years was making sure that I could see patients when they could be seen. So I've decided to add an early morning start on Wednesdays. I start at 7:30, and I have a late evening finish on Thursdays where I finish at 7. And the idea is to get people before and after work and activities. And I think that's actually going to be a big help with just being here. I am a social guy, so I was really glad to find out that I was going to have a partner. And so I'm working with Dr. Davies, who is a great guy. And I think that's about all I have to say.
Thank you very much. My name is Andre Davies. I am a doctor as well here on the island. I'm a primary care physician. A little bit about me, I'm originally from South Florida. I grew up on the East Coast where most of my family still lives. I went to high school at St. Andrews in Boca Raton, Florida. I left and went to Harvard for undergrad where I studied chemistry. Afterwards, I went to Chicago, which is, I didn't quite cross paths with Dr. Balbo, but we were almost crossing paths. I trained at the University of Chicago Pritzker School of Medicine. And afterwards, I stayed at the University of Chicago and did my residency in internal medicine, which is specializing in adult care medicine. I really enjoyed my time in Chicago. I took some time to be a hospitalist at the Northwestern Hospital System downtown. And then afterwards, I finally decided that I wanted to follow my passion and study geriatric medicine. And so I did my fellowship at Johns Hopkins, where I focused a lot on care for the elderly. That took the form of doing home visits, working in the nursing homes, as well as primary care clinic. And through my year, I found I had a passion for memory care, osteoporosis care, preventative medicine for all adults, but specifically for the older patients and frailty. And so afterwards, I came to Naples to do an extended part of my fellowship at Moorings Park downtown, where I focused on leadership skills and qualities, working at the nursing home there. And then I decided it was time to settle down, and I'm very excited and happy to be here at Marco Island, where I'm working with Dr. Babo, and we are having a great time. I look forward to meeting more of you. I'm definitely taking new patients. I've met a lot of you already, and we've had some wonderful experiences. My approach to patient care, I like to think about the patient as a whole. I, of course, address your medical issues, but I want to think about also how are you functioning in your home and how are you doing as a person? And I think that ultimately is an important part of care. And so I look forward to meeting more of you and working with the NCH team. And I look forward to answering any questions. And so with that, I will turn it back over.
Well, I think you can see we have an outstanding team here in Marco. And to the doctors, I have to warn you that the weather here in Marco Island is not the same as Chicago. So I hope that won't disappoint you too much. But you can see we've got outstanding team of healthcare professionals here, doctors that are highly trained in some of the finest programs in America for family medicine. We're just delighted that you're here and part of the NCH organization. So at NCH, we just recently completed a sort of a strategic roadmap that we worked on with a group out of Chicago called Kaufman Hall to really help us look at the future. And one person you can't see here that's been very helpful in informing us about the future is Kevin Fitzgerald, our board chair here. So Kevin, thank you for being here and for your leadership here on the island. But the Kaufman Hall folks and physicians and the community members interviewed, I think became very clear that Marco Island is a key part of the future at NCH. We've got a very strong footprint going from Marco Island all the way up into Bonita Springs with multiple locations and 2 award-winning hospitals and over 1,000 physicians. So we're really excited about the opportunity to serve the residents of Southwest Florida. people have asked Paul during COVID, is that all you worked on was COVID? And I'm pleased to say we were able to work on a couple of other items too that are important to the Marco Island population. Number one is that we made the decision to switch to Epic electronic health record. What that means for you that live in multiple cities or go north for the summer is you will now have a medical record that will go with you anywhere in the United States. Epic is the predominant system in America. So if you have doctors in the north and doctors here, they'll be able to easily communicate. They'll be able to easily share results from tests or x-rays with you. And it should make coordinating your medical care a lot easier than it has been in the past. So we're excited about the conversion to Epic. It was voted on by the doctors unanimously, and that's been an exciting improvement. We'll be fully functional on that next June. So it'll take that long to put all the records in, but a big step for NCH. The second thing that we were able to do just recently was to form a joint venture company with a company called Proscan. And Proscan NCH joint venture makes us now the largest imaging provider in Southwest Florida. So great group of radiologists. We've spent over $12 million upgrading the imaging equipment over this last year. We really believe that we've got the finest imaging technology and expertise that you're going to find anywhere. And we're going to make it very convenient for people in Marco Island and throughout our service area to get CTs, MRIs, ultrasounds, and mammography, all the things that you would need. So a big change there. And finally, and I think one of the most exciting things on our radar right now is you've been following the whole rezoning of the Marco Island campus for NCH here. We are anticipating that rezoning is going to go through within the next 30 days. That will trigger a series of events at NCH where we'll be going for the board approval this summer to reconstruct a much bigger and newer and more modern facility here for Marco Island. We would envision a building of somewhere in the neighborhood of 20 to 25,000 square feet that would allow space for expansion of the clinical services, but also, and importantly, I think, we would be looking to bring subspecialist doctors, more subspecialist doctors here to work with our team here so that residents here won't have to drive north for all of their doctors' specialty visits. And we think that's a very exciting project. And if the timing goes the way we think it would, we could be in the new building in 2 years from now. We'll begin actively working on that. And really a very exciting project. And again, thanks to Kevin and thanks to the board and the residents here for working with us on that. And we think that that'll strengthen our footprint here in Marco and really be something that the residents here will find to be an important step in their healthcare. So with that, Sean, do we have questions coming in on this one or not?
We did actually have
okay.
a few questions. So this one is probably more for Caitlin regarding the Marco urgent care. This person wanted to know if you could share the hours of the urgent care and are you also open during holidays?
Yes, we are open every day from 8 a.m. until 7:30 p.m. Christmas Day and maybe Thanksgiving are the only day that we close at 5 p.m., but we are there every single day.
Okay. Another question specifically for you, Caitlin, for the Marco urgent care is your visitation policy. Currently, can a guest escort a patient into the urgent care or do you have restrictions on visitation?
So for COVID precautions right now, we're still requiring masks. We are asking just for patients to be brought back, but we make special, if someone has any memory issues or for children, of course, we are allowing a visitor to come back. If a visitor is not allowed to come back though, our nurses are very engaged in updating a spouse or a friend who's waiting with the patient's permission about what is going on.
Next question is probably for Dr. Bowden. Is it difficult to move my medical records from my current position over to your practice? What did you do?
That's pretty easy. What I would suggest is, because under HIPAA, medical records are the patient's property, and we basically act as custodians of that. Any medical facility does that. But I think the best way to do that would be to sign a release of medical records at our office so that it goes doctor to doctor. Typically, there's no copying fee involved in that, and it just shortens all the work, otherwise the patient has to do their own legwork, and that seems to be not the best way to do it.
The question is, if you're a resident, you can use the clinic.
Absolutely not. We see visitors from all over. We see locals, but of course, visitors are always welcome.
And also, can you please share your phone number where they can make an appointment? I don't have it. One moment. And actually, a follow-up question then for Caitlin while we're waiting is, do you need an appointment for the urgent care center?
No, we don't take appointments, walk-in only.
The number is 239-624-8180. My much younger colleague here can.
Dr. Davies. I asked Dr. Davies if you'd be willing just to spend a minute. You are a rare bird here in Southwest Florida in terms of your geriatric focus and training. Could you just spend a minute telling the folks what kind of illnesses, complaints you do treat in that specialty field of gerontology? Because I think they'd be interested in that.
Well, I think the first thing is that a geriatrician is very versed in just general care, but specifically for older patients. So for specifically, if you have heart failure or diabetes, or if you have lung disease or any of the usual chronic medical illnesses, sometimes they take a special finesse, I think, when it comes to caring for older patients, because medications are different and their dosings are different, and how you manage them are a little bit different in older patients. Specific syndromes, though, we do geriatric syndromes, and that's what we are sort of specialized in. Things like osteoporosis or osteopenia, so like your bone health and how to treat that, and different treatment modalities. We're very experienced with that. Hearing issues. We have a lot of experience working with people with hearing loss and kind of differentiating the different kinds. We also deal with a syndrome called Frailty. Frailty is sort of a multimodal sort of syndrome that combines nutritional, physical, and sometimes even emotional aspects to how one functions in the world. One of the areas that I'm very passionate about is memory care. So that ranges from, things like simple, mild cognitive impairment, ranging to the different kinds of dementia, similar to how a neurologist would kind of approach and treat dementia and memory issues. Geriatricians are able to do similar things. Those are probably the ones that I can think of at the top of my head. And then we are very, I think we're also experts at some of the other things that I have a lot of interest in. Polypharmacy. So a lot of times our older patients come with long lists of medications, and they need help considering what are important ones to them, which ones can we consider, stopping, which ones are safe to stop and aren't. How do you go about stopping medications? What's the language you use with other specialists when kind of negotiating what medications to continue or stop? So those are something that we sort of do. And then what a big part of my training was sort of just knowing how to work with a lot of different disciplines. So, knowing exactly what happens at physical therapy, occupational therapy, what happens, how does one approach, nursing home care, or maybe advancing to the next step of not being independent living anymore, kind of considering other types of living. So it's a specialized general medicine field that, I've had a lot of fun learning about, and I'm ready to, sort of exercise.
Your conversation was, I have rheumatoid arthritis. Is that something Dr. Davies can treat?
That's a great question. So a large portion of geriatric fellowship is dealing with rheumatologic issues. And I would be more than happy to, if you want to give us a call. And if not, we work very closely with rheumatologists as well. But my short answer is yes.
And then another question, probably for one of these. That my parents live on Marco Island, and I live in and act as their caretaker. Is that something that they could, sibling or the child, the parents could coordinate care through your office easy enough.
Indeed, and I'm sure Dr. Davies has the same approach. We do that all the time. That's rather easy. Happy to do it.
Yeah, I think something that we've sort of been working on too is sort of incorporating like technological aspects to the visit. So whether it's conferencing the child of the parent over the phone, or hopefully eventually we'll be doing some sort of like iPad or visual aspect as well. It's something that we've been sort of working on in the clinic, but it's the purpose is to sort of make it a team-based approach with people who are abroad. And also we spend a lot of time talking to family members over the phone as well outside of the appointment. So we're available.
And I think to go with what Paul was talking about with Epic, that's both Dr. Davies and I worked extensively with Epic in the past. It really does have the capabilities where we can actually view components of that record as well concurrent with talking to family members. It's going to really help.
One thing I did want to, it was announced this last week, but I wanted to reiterate something that NCH just announced this week that we've recruited away from the Cleveland Clinic, one of the top cardiologists in the country, Dr. Robert Kibedu. He will be starting June 1 to lead as the president of the Naples Heart Institute. That will trigger an expansion of cardiology services throughout our service area to include Marco Island. So look for, our heart program has gotten so good, so strong, and has grown so much that you may have experienced in the past some difficulties getting in timely to a cardiologist. But our intention is to recruit in an additional 4 to 5 cardiologists to make it easier for you to get in to see a cardiologist. And we'll be expanding in Marco Island as well as other parts of our service area here too. So very exciting. Our intention is to become a top 100 heart health system in America, and we're well on our way to getting there.
One other question, this is for Hayden, is if I come to the urgent care center, will I be seen by a doctor at the urgent care or a different type of clinician?
Currently for high season, when it's very busy down here on Marco Island, we do add on a physician extender, either a nurse practitioner or a physician's assistant during our peak hours, but we always have a physician on the entire time we're open.
And then the last question just came in, what is your typical wait times at the urgent care center?
It's not too bad. We usually try to have our patients brought back by a nurse as soon as they're done being registered. They start the triage process and get them into a treatment area. So I would say total length of stay for most patients is well below an hour.
That wraps up the Q&A section.
Well, again, thank you, Kevin, and thank you to the folks here in Marco Island, doctors, and Caitlin. Thanks for all the work you're doing. We've got a great team, and we'll be anxious to get your feedback on this kind of a format. If it's something that works well, we'll be continuing to do these, and we'll continue to update you on the progress around the new facility and some of the expansion plans that we have here for Marco Island. So with that, I would just say thank you, and we are here to serve. And if there's anything we can do to be of help for you or your family's healthcare needs, please feel free to reach out to any one of us. So thank you.